I am making this video for a friend who just tore his gastroc muscle in here, and I'm showing him how to do an ACE wrap, but this is Coban. I like Coban better. You can get this at the pharmacy. You can get a tighter compression with it. Preferably for someone this size, I would prefer to go 2 inches. I think this is 1.5, but you'll get the idea. I want to push the fluid up. I want the lymphatics to go up. I want to control swelling, and I'm going to start at the foot. A lot of times swelling will come down. You never want to go in a circumferential pattern, round and round. You always want to do a kind of a V pattern or a figure 8. That way you don't get stasis of the blood vessels, and you don't compress them and cause any constriction. So I'm starting in my figure 8 pattern. I've got him flexed to a position that doesn't hurt. I don't want him to have any pain. And so when I'm down here, I'm going a little tighter. When I go above the ankle, I'm getting a little bit looser, but still some tightness here. So I'm getting this nice little sort of figure 8 pattern, or a V, going down and up to get where I need to go, which is going to be up here. So I just continue that. I make sure that there are no wrinkles, because wrinkles can cause pressure, and we don't want any bad pressure. If you're working with somebody who has diabetes or decreased sensitivity, any crease can cause a problem. My friend does not have either. He has full sensation. This guy has full sensation. So we're not going to have a problem with this. So I keep going up and down. Now that I'm getting into the mid leg and he's got limited muscles here, I'm easing up a little bit on my pressure. And I almost went circumferentially, but I'm going to make sure I don't do that. So I'm doing my little 8 pattern or V pattern, whatever you want to call it. This is probably, this guy's big. I think I'm going to run out of Coban. And I am. So I would continue doing this all the way up, depending on the swelling. You don't want it to cut off here. I would go above the knee for the swelling. But if you go up to here, lighter here, heavier here for compression, that should do the trick.